I think it'd be interesting to see if there are differences in clinical characteristics between institutions that are using Liso-Cel strictly for a clinical trial basis versus those who are giving it as standard of care. And I think that may help answer where these inequities are coming from. We know that in those in the real world setting, they received at least one more line of prior systemic therapy compared to the clinical trial patients. It was a 3 versus 2 respective difference. So it'd be interesting to see why did that difference exist? Why aren't patients in the real world setting going to Liso-Cel sooner? A few questions that we need to look further into is those that received Liso-Cel in the outpatient setting, how many had chemotherapy-refractory disease, and in those in the clinical trial setting, how many had more than one comorbidity, considering those in the real-world setting did have, at least half had more than one comorbidity, but we don't have that data for those that were enrolled in the clinical trial. But overall, my hope is that we can make the cell therapy more accessible to centers that may not be classically associated with clinical trials, and clinicians in other settings, including those that are focused in the outpatient setting,